I just want to do God's will.
The kind of revolution that the world needs is a Christian revolution.
If you want a miracle, you've got to expect it to happen.
You are the recipients of God's grace and God's blessings, and you rejoice in that reality.
Welcome to Life Today Live. I'm Randy Robinson. Good to have you here. I'm going to see if I can you see a little bit right here. Yeah, that's a scar from a surgery I had at the beginning of the year, and it was to correct a nerve issue. Everything's good. Don't worry about it. But I say that because I am still dealing with random bills from I don't know where sometimes. And I have health insurance, and they say, yeah, this is how much it'll cost you with the insurance, which goes up and up and up. And then it costs more and more and more. And this is not the first time I've been through this. And every time I have to deal with our healthcare, the whole structure, I mean, I'm glad I've got it because you look at the bill and you're like, I could never pay that, But you go, is this really a good system? What are we doing here? Well, we're going to have kind of that conversation today because I think we all deal with this. So this is where you and I live. My guest today is someone who's really in it. She has been an advisor at the White House. Right now, she's the executive director of the Alliance of Healthcare Sharing Ministries, which is interesting. It's a ministry, and we'll have questions about that. But her name is Katy Talento. You've probably seen her on various news channels. She's an epidemiologist, so she understands the industry, but she also understands the policy side of it. And some of the things may be going on right now, currently, to try to make America healthy again. And so we're excited. Interesting conversation today. I appreciate you guys are here. You know someone who's dealing with things, who has dealt with this, interested, hit that share button and let them know. Katy, welcome to Life Today Live. Great to have you today.
Thank you so much for having me, Randy.
So is my experience unusual, or is this pretty much what everybody goes through anytime we're dealing with the healthcare system here?
It is absolutely standard. Everyone is, getting predatory collections and billing and surprise bills and bills from out-of-network providers that they didn't know they had at an in-network facility. Congress is, trying to solve some of these problems because they're so insidious and pervasive. So everyone is going through it right now or this year.
So a friend of mine is a doctor, former roommate from college, is a doctor over in Dallas. And we had this conversation a while back, actually, and he says that a lot of his costs, a massive amount of his costs that he has to pass on to people like me is to insurers and lawyers. Is that an issue in the healthcare system?
Absolutely. I mean, the insurance industry, we think that their value prop is that they can get volume discounts that you couldn't get as an individual cash pay patient. Mm-hmm. That's sort of how they sell themselves to insurers is we'll get you cheaper medical bills. But it turns out that negotiated rates that insurers get are higher than cash pay rate. So what's that about, right? So it's all a fraud. They're actually in league with the giant hospital corporate systems, with the big Wall Street owned pharmaceutical benefits manager companies. And the entire healthcare swamp does better when, we're sick for life, when we're patients for life and consumers for life. And it's working for them. Like it's designed exactly perfectly for them. And we are the sickest, fattest, saddest, most infertile, most medicated, most treated, population in human history. So everything's good for them.
Yeah. I mean, and you know what, you mentioned the insured versus uninsured. I can attest to that because it's been a while, but I went in for MRI, some kind of scan, and they said, will this be with insurance or without insurance? And I said, I have insurance. And I'm like, wait, what's the difference? And it was like $300 versus $800. And my deductible wasn't going to cover the $800. So I was like, uninsured. And I was like, what is going on? How did we get to where we're at in the wealthiest country, I think arguably in the world, and with the smartest doctors and the best facilities? And I know many of them are good. They want to help people, even some people. A friend of mine's a drug, a pharmaceutical rep, and he just wants to help people. There's a lot of good people in it, but somewhere there's something off in our system. How did we get here?
Well, it's $1 trillion industry, multi-trillions, and it's a fifth of our economy. So of course, in an industry that's that large, there's going to be tons of really good people, right? There's lots of really good people in the system in all aspects of it. But I call it weaponized complexity. So when a system is that huge and there are so many layers upon, there are industries within that industry that no one's ever heard of, right?
Right.
I mean, it's just, so there, you can't be, your doctor friend is not an expert in even a third of the healthcare industry. Your pharmaceutical rep friend, not an expert in even her pharmaceutical industry or his pharmaceutical industry. Like, there's so much complexity there. How does an employer who pays for this, or a taxpayer who pays for half of all healthcare, or an individual patient, what chance do we possibly have against that kind of weaponized complexity? It's being used against us because incentives matter. And so even though all these good people are involved, the financial incentives do drive the structures of the contracts between all these parties. When your employer pays premiums, and they usually pay 2/3 to 3/4 of everyone's health insurance premiums, most of the country is insured either on a government insurance plan like Medicare or Medicaid, or they're insured through their employer. And so when you've got someone paying, some third party paying, that employer is not party to all the contracts that govern the system that they're paying for. The contracts between the carrier, the insurance carrier, and the hospital, the contracts between the pharmaceutical manufacturer and the insurer. Like, your employer is bound by the terms of all those contracts, but they're not a party to those contracts. It's a very distorted, it's a system that distorts market functions, so that we don't have price transparency, we don't have contract transparency, we don't know the terms and conditions under which we are receiving a good or service. So that's going to distort this into a market. I grew up kind of as an adult, I grew up in the policy space here in Washington, where little Republican children, they go into healthcare policy, and we have this sort of knee-jerk defense of the free market, and private sector is better than, Bernie Sanders' government takeover of healthcare. So it must be good to defend these private sector actors. And so our knee-jerk defense is of industries that have become increasingly indefensible. And, we have neither the free market's neither free nor a market. And so when you have all these market distortions and all these price distortions and hidden prices, you don't really have a market. It's unlike anything else out there where you buy, you go on Amazon, you buy a TV, you know what you get, and for the quality and for the price that you're getting, where it's made, who's involved, what company is putting their name on it. And so it's just different than anything else out there in the economy. And so I think that's why, you're seeing the problems and distortions you're describing.
Yeah, I think a little bit of it also goes to the fact that if you have insurance, you go in and you're kind of spending someone else's money at that point. And so you don't care what it costs because you think insurance.
I think that used to be true, but increasingly people's deductibles and their sharing is so high. That's fair. That people, one of the number one reasons why people go into debt is medical debt, and most people are insured.
Right.
This is supposed to insure us against financial ruin, and yet so many people are being ruined nonetheless.
Yeah, it doesn't. It is complex, which makes it hard to even want to scratch the surface. But it just something clearly is off. Okay, I want to ask you about this website, which is ahcsm.org, the Alliance of Healthcare Sharing Ministries. What exactly is that, and is it working?
Yeah, so healthcare sharing ministries are sort of, kind of a Christian hack of this system, a bypass of the insurance system. Healthcare sharing ministries are communities of religious believers that come together to share each other's medical bills. And so it's not insurance. And I think so many of us are so used to insurance that we kind of see this whole system through an insurance lens, and they're like, okay, but what's the premium? What's the deductible? This is not insurance, and it doesn't work that way. But what happens is you go to the doctor, you say, I'm uninsured, because we are, and you get the cash price, and which, like we talked about, is often cheaper than an insured price. And then you get your bill after the fact, and you upload that bill to the ministry's portal, and then the ministry taps some other members on the shoulder and says, hey, we want you to send your monthly contribution this month to Randy for his nerve surgery. And you'll get a bunch of checks in the mail, or this can happen electronically through more high-tech software. You get a deposit in your bank account, but from those other members. So it's this direct member-to-member sharing, and it's really beautiful. I kind of think of it as a homeschool co-op for healthcare. And we try to take advantage of those cash prices. And we try to, some of the ministries will negotiate with hospital systems to try to get those bills lower. Okay. And to coach you how to do so on your own behalf. But sometimes, we can't. You can only do so much. Sometimes we just have to pay those high bills, like everyone else out there. But it is, I think, important when you're in the healthcare system. You're there. You're vulnerable. It sometimes is a scary time. It can be a life and death kind of vulnerability, kind of scariness. Oh, yeah. And so, or it's about your child, God forbid, or, someone you love. And so it's this really vulnerable time. And that's just the last place that you want some cold corporate Wall Street owned bureaucracy in the exam room with you, And so having the body of Christ, having a community of people that are praying for you by name and that you can call and get prayer, it's a different model, and I think it's a more humane model.
Yeah, I mean, it's interesting. The whole mess of it just makes you want something different. Are you in D.C. right now? Is that where you're at, in Virginia?
I'm in suburban Virginia, Loudoun County.
Loudoun County. We know those guys. Right. Not always for good things. So what do you see going on right now? Because the whole RFK Jr. thing with Trump bringing him in, I mean, it's an odd time in D.C., I think. But, I mean, I disagree with RFK Jr. on probably more than I agree with him. But one thing I agree with him on is that the health of our nation is poor. And so I was kind of excited to see him get in there. Are we making some progress? What do you see going on that close to the nation's capital?
Yeah. So I think what you said earlier, Randy, about how, gosh, when it's so bad, you're kind of open to any alternative, right? Right. And I think that's how, government is, that, we're kind of welcoming the Doge shock and awe and the Bobby Kennedy as Secretary of Health. Okay. We're just kind of open to radical change because it's so bad out there and our health is so bad. Our children's health is scandalous. More than half of all children have a chronic illness. It's crazy. I mean, imagine that. And so, a third of all teenagers are pre-diabetic. We have fatty liver disease, which used to only be for alcoholics. Right. We have fatty liver disease showing up in teenagers now. So something has gone completely off the rails. And yet our entire biomedical research enterprise is focused on genetics. But genetics don't cause epidemics, right? At all. You can't change genes fast enough for that. So something else is happening, and it's an environmental exposure of some sort. And we don't know what that is. Is it chemicals? Is it processed food? Is it, all the screen time? Is it not being in the sun? Is it pesticides? Is it all of those things? And so is it all the drugs we're on? Is it vaccines? Who knows? But all these things are like novel experiments in the past century in human history. So it seems like insane to me that we would think it's insane to question this stuff. Right. But Bobby Kennedy gets sort of demonized for questioning these things that have, been completely introduced as radical interventions into people's bodies and our lives just in the past few generations. So yeah, I'm ready for shock and awe. I'm ready for radical changes and policy experiments because we are in such abject failure, and it is an extinction level situation and threat for us. The sperm count for the entire world has gone down by 50% since 1970. 50%. And we are at a fertility crisis. I'm not kidding when I say extinction level. And, one of the most common reproductive diseases that women get is polycystic ovarian disease, which is actually a form of diabetes. It comes from insulin resistance. So if you change your diet dramatically and get off carbs, women are often cured and reverse that condition. So this fertility crisis that we are seeing is so threatening to our future and our children's future. And yet it's so intervenable. We can change this. So I really appreciate Secretary Kennedy. I'm excited about everything that I'm seeing out of the department. And I think we're going to see even more in the coming months.
So when you say that about the fertility rates, I mean, my mind automatically goes to, okay, they're actually, ever since I was a kid in the 70s and 80s, there's been a population control movement, But I am not quick to jump on, conspiracy theories. But then a lot of them turn out to be true, and you got to go, okay, what's going on here? But there's some very questionable things. Okay, you mentioned so many things. An easy thing, when you go overseas, as I have, sometimes you'll get the same food you get here, but they taste different. You go, what is that? Well, okay, they don't allow certain preservatives and chemicals in the foods in like Europe that we have in the United States. And you go, well, why not? You start going down that road and you realize that, the processed foods that we eat and the foods that even when we try to be healthy sometimes, they're contaminated, or they're not like something that you've grown on your own farm in good soil. So yes, the food we eat is obviously an issue and really needs to be addressed. And we can do that. That's something that's in the power of me and you. I can address that in my own life immediately and have. But then you get into things like the pharmaceutical companies and you go, okay, I mean, I recognize, when I had my surgery, they numbed it, they gave me painkillers. I didn't take them. But I'm grateful because when you need a painkiller, you need a painkiller. But the over-medication, back to my doctor friend, drives him nuts when people walk in and say, I need this drug. I saw a commercial on TV. He's like, I'm your doctor. I need to make that decision. But we are convincing people through a media blast, this CNN report brought to you by Pfizer, that we need to be medicated. And I read some of the conspiracy theories about big pharma and I go, that can't be true. But then I look around and I go, that may be true. Is big pharma good or bad? Can I be that simplistic about it?
I mean, I would say that my view is that big pharma is a net harm.
Yeah.
But a net harm, right? Yeah. There's good there. Mm-hmm. I think the bad outweighs the good, but there is good there. And, I've got 2 little nephews with special needs and they're on some radical drug regimen that keeps them alive. Mm-hmm. So I think that we all need to view this from the lens of what is, human biology. Okay. And, you talked about, well, we can make our choices on food now, right? You and I can make our own choices.
Somewhat, yeah.
But right, somewhat. Yeah. You think about children going to school and your average American, yes, they could make healthy choices if they can afford them. Mm-hmm. But do they even know what is healthy? I mean, we're told by the American Heart Association that it's okay to have Coca-Cola, that processed food is okay, and that, are we told that the American Heart Association is taking money from big candy and big sugar and big soy and the Seed Oil Association? I mean, are we told that they put out the saturated fat myth because animal fat is saturated fat and processed oils is not, right? And animal fat is not profitable. So, there are so many ways that we're being lied to by interests that are hidden from us. And these institutions of trust, your doctor friend wants to be trusted. He wants that to be his decision. But how have the decisions of the doctors over the past 5 years earned anyone's trust, right? And so I think it's actually quite healthy that the institution of medicine is starting to lose the bloom is off the rose in the eyes of the American people. And I think that's healthy because now the only thing that's going to save us truly, nobody's coming to save your health. And I think what you mentioned, Randy, about how, people need a painkiller when they need a painkiller. And that's true. But I think we're so conditioned in our convenience all the time culture we need everything fixed. We need to, I'm feeling bad, fix it. I'm feeling sad, give me an SSRI. I'm feeling some pain, give me a painkiller. we are not used to listening to our bodies, and we think our bodies like randomly go off the rails. No, our bodies are organisms. They're responding logically and brilliantly to what's happening. They're adapting. Our symptoms are adaptations of some sort. They're trying to communicate with us, and we're not listening. Instead, we're trying to tell them to shut up. Just suppress that symptom. Just shut up. When really like most of the diseases that are killing us are not diseases, they're symptoms. Inflammation is a symptom. So cardiovascular disease is a symptom of inflammation, which is a symptom of an exposure. So what are we being exposed? So there's all these root causes that our bodies are reacting to because we're living unbiological lives. I mean, just think about most humans in all of history spent most of their time outside. Think about the infrared, the health impacts of infrared light, the health impacts of vitamin D, the health effects of properly set circadian rhythms, where we go to bed when the sun does and we get up when the sun does. Like what is happening? Our hormones are all designed to operate around the system of the sun. And so, I mean, vitamin D itself is a hormone. So everyone in our society is vitamin D deficient. Vitamin D is a precursor for many, many of our sex hormones, many of our mood hormones and neurotransmitters. So it's making us sick is trying to communicate that we're living wrong. We're living wrong.
Yeah.
And we're not listening. We're just telling it to shut up.
Yeah. Yeah. I literally recently had some drainage and someone said to me, why don't you take something for that? And I was like, I got something in my body wants out. Let my body do the work instead of drying it up with a drug that's going to make me cloudy in the head. So yeah, I listening to so when you get down to what can the average person do, because we're not policy makers or influencers. We're just people trying to decide if that organic vegetable really is better than that other vegetable at half the price. Yeah. How does the average person combat such a large and financially influential system just to take control of our own health?
Yeah, the first thing I would say is if your great grandmother wouldn't recognize it as food, don't eat it and don't drink it. And so that'll take all the processed food off the table, and especially including food that is drowning in pesticides like Roundup, otherwise known as glyphosate, which is a known carcinogen. It destroys your microbiome, which controls much of your health. And so, I do think that organic vegetable is worth it. It's worth the extra cost. And the more of us that buy it, the more the cost will come down. So we need to contribute to that supply and demand curve in the organic space. But organic is just like the bare minimum of not being like drowned in poison, right? That doesn't make it healthy. It just means it's not drowned in poison. So yeah, I think going back to whole foods that your great grandmother would recognize is the very first thing. And that's not easy. That's a big one. But if you do it, you're halfway there.
Yeah, and you can find a lot of those locally. I bought some local honey. Like the guy, it had a sticker that said, "This has not been approved by any government." It was like, He does it and is really good, by the way. Okay, for the person who's interested in healthcare sharing, we have the website. But what's sort of the process for someone who's like, I'm curious about that?
Yeah, so you can go to our website, ahcsm.org, and I would say look into these ministries, ask them if they've been accredited, ask them if they're members of the Alliance. You want to make sure you're with a reputable organization that's a real healthcare sharing ministry. But then, you're required to attest to religious beliefs. So it's not for everybody, but it is for Christians. And also you're required to commit to treating your body like a temple of the Holy Spirit. So eating whole foods is probably the first great step to becoming a valuable and wonderful member of a healthcare sharing ministry.
Well, when I'm finished with my processed pork rinds and my pack of cigarettes, I'll look into that.
Actually, pork rinds are some of the least offensive.
Are they really? Okay.
Actually, it's actually really good for you.
It's just off the top of my head. Like, what can I come up with? I'm thinking more Funyuns, the fake ones.
Yeah, stay off the Funyuns.
All right, Katy. Interesting information. Definitely worth people thinking about. Don't rely on someone else to take care of your health, people. Take control as much as you can. God gave you one body, and we're supposed to take care of it. Last word, Katy. Again, I appreciate your input, your expertise. Anything we need to be aware of?
No, I just think that, when you take control of your health, you're changing generations because our children's palates, what they want to eat as what they consider comfort food, is set very, very young. So to the extent that we change our lives and we can start to influence our kids and even our grandkids, I had too many sins with my own kids. I'm working on my grandkids now. So we have a chance to save those generations from this extinction level threat. And so we have to do it and call on God for help.
Yeah, I can relate, but we're working on it. Okay, you guys out there watching can work on it too. You can hit that share button and let someone else know. Hey, here's some good information. Here's something to think about. Let's take control of our own health and do it God's way. Appreciate you guys being here. If you haven't liked, follow, or subscribe, please do that. We'll see you again next time here on Life Today Live.
You're the fruit. You're the fruit